Good afternoon to all. Allow me to adopt the protocol, but I must recognize at the head table the Honorable Prime Minister, Dr. Timothy Harris, Permanent Secretary within the Ministry of Health, Dr. Dolores Stapleton Harris, and our PAHO country representative, Ms. Katrina Smith, as well as our Chief Medical Officer, Dr. Hazel Laws, and our Medical Chief of Staff, Dr. Cameron Wilkinson. These vaccines that we are receiving today from the COVAX facility, we have been hearing so much about them over the past year, and we are so pleased that today we are able to receive these vaccines. I am even more happy that we're receiving these vaccines today because, as most of you should know, today just happens to be World Health Day 2021. And in the spirit of World Health Day, and the theme for this year, building a fairer and healthier world for everyone, I believe that is indeed important. And this is indeed an important occasion that we will be able to receive our COVAX vaccines at this day. And I thought that it was important for us to even reflect on the meaning of today as we receive these vaccines. As we all know, the World Health Day continues to be recognized annually since 1950 to commemorate the commissioning of the World Health Organization. The organization has a broad mandate which includes advocating for universal health care, monitoring public health risks, coordinating responses to health emergencies, and promoting human health and well-being. The World Health Organization's founding is seen as a significant opportunity by the entity to draw worldwide attention to a subject of major importance to global health each year and to mitigate against disparities in health at the country level. Accordingly, the WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. However, many proponents of health and well-being have concurred that the meaning of health has evolved over the ages, since the state of a person's normal health function could be disrupted from time to time by disease, other variables, and at this juncture, the coronavirus pandemic. Being cognizant of this, the theme of World Health Day 2021, as I said before, is building a fairer and healthier world for everyone. Today, in particular, and more than ever before, we must foster an all-of-society approach campaign to build a fairer, healthier world. The theme, therefore, embraces a strong clarion call for urgent action to eliminate health inequalities and to mobilize action to attain better health for all. According to the WHO, health inequalities are unjust, unfair, and widen the equity gaps, preventing persons from reaching their full potential. These health inequalities are largely felt among those who are disadvantaged and who often experience discrimination, resulting in illness, morbidity, and premature mortality. Reducing health inequities is an imperative because health is a fundamental human right. Everyone deserves to live a healthy life, regardless of their age, gender, ethnicity, disability, economic situation, or employment. It was Dr. Joy St. John, the Executive Director of the Caribbean Public Health Agency, CARPHA, who suggested that health inequities go against the very fabric of social justice because they are avoidable, is a succinctly profound reminder of our role within a healthcare sector. Several factors contribute to inequities such as poverty, unemployment, environmental challenges, gender inequalities, and most recently, the emergence of COVID-19. The pandemic has had grave consequences for people already experiencing inequities, and it has disproportionately impacted persons already socially and economically disadvantaged. While COVID-19 has significantly and adversely affected all countries, its impact has been harshest on those communities which were already vulnerable, who are more exposed to the disease, less likely to have access to quality healthcare services, and more likely to experience adverse consequences as a result of measures implemented to contain the pandemic. The World Health Day comes at a very critical juncture in the history of humankind when the COVID-19 pandemic has affected 0.13 billion people globally. The pandemic has, for the first time in our recent history, brought health to the fore as an important public policy matter. In addition, the pandemic underscores the importance of public participation in any policy measure. At the same time, it also highlights the importance of continued vigilant preparedness and prudent increase in public spending to build and sustain infrastructure that will ensure equitable health care to all. As the pandemic should not allow for the more basic health problems to attract less attention and priority. Therefore, addressing our challenges of communicable and non-communicable diseases and our health promoting programs must remain a high priority as we embrace the UN Sustainable Goal number 3, good health and well-being for all. Clearly, therefore, we must continue our quest to build a healthy federation with access to safe drinking water, nutritious foods, and clean air, and the promotion of physical activities, which are the genuine underpinnings of a fairer, healthier world for everyone. Hence, as a federation, our mandates include working together, hand in hand with affected communities and individuals to address the root causes of inequities and to implement solutions within and beyond the health sector. Collecting and using timely and reliable health data, which are disaggregated by gender, age, income, education, disability, geographic location, and other characteristics relevant to the national context. Only then is it possible to assess inequities across population subgroups and take impactful actions. The strategies above are key to addressing the challenges of ensuring health for all and to building the resilience of tomorrow. However, the impact will be greatest when governments and communities work together in a coordinated approach. In addition, we are required to function beyond our national borders. For example, only when we can protect, test, and treat the whole global population can we end the COVID-19 pandemic. Only when we access an equitable supply of vaccines, tests, and treatments can we strengthen national and international mechanisms and build community trust and confidence. The receipt of this 21,600 doses of the WHO-approved Oxford AstraZeneca vaccine from the COVAX facility today is timely when we are celebrating our World Health Day. Further, it is a profound manifestation of the required strong multilateral cooperation towards managing the coronavirus pandemic. We firmly believe that only the vaccine can rein in the pandemic. So, as we commemorate World Health Day 2021 amid the pandemic, we should all be first grateful for our healthcare workers who are working diligently to manage the virus, as well as to commend the efforts of our global health scientists and researchers for manufacturing safe and efficacious vaccines to strengthen and sustain our health systems in the quest to mitigate social and health inequities. The Federation of St. Kitts and Nevis joins the world to observe World Health Day and continue to play its part to ensure that health inequalities are eliminated, quality services are available, accessible, and affordable, and that no one is left behind within our healthcare system. And today, I just want to remind everyone, the pandemic will not be over until we all do our part. We now have 21,600 doses, and we're counting on each and everyone who is eligible to step forward and be vaccinated. If it is you still need more information about the vaccines, 311 operators are available. Don't let your lack of knowledge be an excuse for not being able to step forward and be vaccinated. It is up to each of us to do our part. The only how we can get back to what is some form of normalcy is if we all are vaccinated. And so I'm urging one and all, let us use this 21,600 doses and see how much more of our population we can get vaccinated. That is how we're going to get back into our jobs. That is how our tourism will continue to boom. That is how we will be able to make sure that each of us are able to feed our families and loved ones. And so I'm asking one and all, think about it that way. What is your contribution to ending this pandemic? All you have to do is step forward and be vaccinated. So please remember, don't wait, vaccinate, and also, happy World Health Day. Thank you.